Hi, I'm Sarah Somers. I'm the coordinator of the steering committee of the Nurses and Midwives certification, and I would like to provide you some information on how to write ethical cases that are requested to apply for the Nurses and Midwives certification. Okay, so how do you write the ethical cases? First of all, you think of an example in your clinic of a situation where the law was in contradict with your ethical point of view, or where a couple came up with a rather uncommon request. If you cannot come up with a topic, you just talk to the psychologist of the team or some gynecologists or medical degrees, and they will help you out. So the example that I want to present here is the example of a gay couple who have a wish for a child, and they need, in this case, an oocyte donor and a surrogate. Then you start reading, because you will not be the first person thinking about this ethical problem. I don't know if you're familiar with databases such as PubMed or Web of Science, but if you are, you can look up the papers of the ESHRE Task Force Ethics and Law, and they have ethical papers on different topics. The first paper I found here is a paper on gay couples, so this one is a paper I can use. There's also a paper on gamete and embryo donation, which is applicable to oocyte donation, so I will read this paper as well. And then there's a paper on surrogacy, which I will show you here. So you click on the link, then you go to the PDF, so to the first page, and then you click on the PDF, and you have a file that you can store on your computer and that you can read and make markings. So the next step is that you start writing your ethical case. We have provided you with guidance, 10 steps on how you should write your case. So you can find them when you go to the ESHRE website. You click on accreditation and certification. You go to the ESHRE certification for nurses and midwives. And then you go to info for exam applicants and frequently asked questions. And when you click on the plus, you have all the 10 steps to write your ethical case. So we will now go through the 10 steps. The first step is the identification and description of the ethical problems or dilemmas. So in my case, we are talking about a gay couple. They came to the clinic because they had a wish for a child. They already had an oocyte donor, and the plan was that she was going to donate oocytes to the oocyte bank, and then the gay couple would receive anonymous oocytes in return. This is to shorten the waiting time for them to start treatment, and they already had a surrogate, and the surrogate is the sister of the non-biological parent. The problem here is also the fact that in Belgium there is no law on surrogacy, which means that the mother giving birth to the child is in fact the legal mother of the child. So in this case, this should be the surrogate. So that's the ethical problem. The second step in the writing of the ethical case is the analysis of ethically relevant clinical information. So we are talking here about a case of full surrogacy, which means that the gestating woman has no genetic link to the child. This is also a case of single gamete donation, which means that we don't use the gametes of both intended parents, which is not possible. And then the surrogate is a sister of the non-biological parent, so there is a family connection there. The third step is that you make a list of the ethical principles and values that are related to the case according to you. So you can really use bullet points. The first one here, for example, is respect for autonomy. So all the parties involved voluntarily accept certain restrictions on their autonomy. For example, the intended parents and the surrogates cannot unilaterally change their minds after the start of the pregnancy. A second ethical principle is a combination of this respect for autonomy and justice, which is that a male homosexual couple have a right to reproduce as much as heterosexual couples. Then you also have the beneficence, non-maleficence ethical principle, which actually means do no harm. When you apply this to the surrogate, for example, you will need to screen the oocyte donor and the intended parent for HIV, hepatitis B and C. And then you also have the welfare of the child. Although empirical research is limited, men can be equally competent parents as women, and the absence of a female parent does not negatively affect the child. The next step, step 4, is that you make a list of the different parties involved and that you indicate their interests and rights. So the first party are the intended parents, so they have an interest in fulfilling their wish for a child and reproductive autonomy. The oocyte donor and her partner have an altruistic interest. They want to help this couple. Then you have the surrogate and her partner. They also have an altruistic interest in helping her brother and their brother-in-law. And they have the right to be protected against family pressure and health risks, for example, if you do not transfer a single embryo. And then you have the future child, which has an interest in reasonable welfare. So the 5th point is that you have to consider the societal and legal aspects which are relevant to the case. In this case, there are no societal aspects. The legal aspect is the fact that there is no law in Belgium regarding surrogacy. You should also consider alternative options. So for this couple, they should consider not having children. They could consider adoption, and they could consider foster care. The next step is already step 7. You formulate a resolution and you explain your proposal. So this case needs to be discussed at an interdisciplinary fertility staff meeting after positive advice of the clinic's ethics committee, and the decision on whether to accept the couple or not should be based on the ethical principles defined above. The fact that the surrogate had a fulfilled child wish, a partner who stood by her side, and that there were no signs of commercial surrogacy will also impact the decision. The next step is that you should consider how your resolution could be implemented in practice. So, first of all parties involved should be counseled and screened separately by independent specialists. Then a cooling off period is recommended so that all parties can think through their decision. All parties involved should also sign an informed consent form. And the intended parents, surrogate, and her partner should be asked to contact a lawyer to draw up an agreement, although this document has no legal value in Belgium. So as said before, here you can also give more examples, but you have to stick to the limit in words. Did you have a discussion about this case or similar cases with members of your team? Yes, we did have a discussion. In fact, when people want to use gamete donation or surrogacy, they have to visit the counselor of the department, and then every case is discussed in the multidisciplinary staff meeting. In the case of surrogacy, the ethical committee of the hospital has to give it a go before you can proceed. So that's what happened. And then the last step is what do you consider to be your role in this case as a nurse midwife? You are involved in patient care, so you will be counseling this couple too, and you have a role to junior colleagues or to your team to give an explanation maybe on what you read about this particular case. So when you go to the ESHRE website, you go to the My Certification profile, and there you can add your 2 cases. So you have these 10 steps, and you fill in per step your explanation. You have to do this twice because we ask you to write out 2 cases. And please use your colleagues, ask them to give them feedback. Maybe if English is not your mother tongue, you can ask them to give corrections on spelling or grammar, or you can ask your colleagues to if your story is a clear and concise story, or if they have tips for you regarding your reflections, so you can use them. Then you have to save your case, you have to also complete your logbook and stuff, and you have to wait, in fact, for the steering committee to approve your ethical cases. If we think that your ethical case is not really an ethical case, we will come back to you with the question to think about it, to make it better, to improve it, and then you are able to resubmit the case. Thank you for your attention.